Hello, everybody. This is Dr. Duncan McCollum coming to you for the first time from McCollumWellness.com radio. I now have every Saturday at 3 o'clock on KSCOradio.com. So excited to kick this off with two of the most amazing doctors, Dr. Scott Kramer from Redding, California, and Dr. Matt Diderot from the world. He's traveling around the world right now getting these stem cell machines in different clinics, and we are making such amazing changes in people's lives. We all had a radio show about a year ago, and we're coming back to say what has happened now. So Dr. Scott, I know you got to get back to your patients, so I'm going to let Dr. Matt and Dr. Scott take it over for now, and we'll see you in a few minutes.
Yeah, I'm really excited because it's been almost a year that you both have had this wonderful technology in your clinics, and we're going to really recap what it's been like. And first off, let me say thank you for believing in this technology and trusting in me to put this into your communities. And thank you so much. I was lucky enough to see Dr. Scott this past weekend. He was in Georgia. And Scott, I know you got to get back to see patients. Go ahead. Tell us a little bit what you've noticed over the last 11 months.
Well, I can tell you what, I've been in practice this is my 26th year. And we've always had, seen a lot of people, young people, old people, multidisciplinary. And when I saw this technology over a year ago, I just knew I had to have it. It was almost too good to be true. And we talk about different things like that in the office where it is too good to be true. So first of all, thank you for bringing it to us in the world and to our group. Because, after 25 years of practice, I think I told you this has probably been the single most powerful thing I've seen to see more miracles than it before. And in chiropractic, we see a lot of those every day, but this technology literally opens up the healing pathways of the body like no other. And so we've always talked about, the power of the innate body heals the body, heal itself. But when you target it with the TRT, the stem cell machine technology, we literally see pain come alive. We see miracles happen every day. I think, when you have Dr. Duncan talk also, you're going to see testimonial after testimonial. I think you were there when you trained me and we saw Shen, who was offered or who was sponsored on the show, The Doctors, right? For her amazing response to her low back and chronic leg numbness, deadness, and literally in a couple visits, she's almost 100%, and she's still that weight today. And so, as far as patients, from chronic knee stuff to with 3 and 4 surgeries who were literally disabled and can't walk, to foot, ankles, extremities galore. So we can go on and on. I've had patients who have had 2 and 3 surgeries that have deformed toes, almost worse than a ganglion cyst or neuroma, and you're 100% today. And so we could never offer that or do that before this technology. And coming down to it, not only does it just help pain inflammation, but it truly does help long-term stem cell production, long-term healing, performance of the body that we haven't seen with any other technology that I've seen so far. So awesome stuff.
I made a claim recently, and you guys can really verify it. You've had it longer than most any other chiropractors in the country. And what I said is, I believe that this device paired with chiropractic could really elevate our profession to levels we haven't seen in over 125 years. And what's your take on that?
Oh, I agree 100%. 100%. Before we put people on care plans and everyone does well, but the limiting factor is how well that body can heal. And this technology literally elevates that possibility like infinitum. It's crazy. And so, and I think I told you also, another thing we're learning also, and Dr. Duncan, is we're literally turning on different myotomes. And for people to understand that, they're patterns of the body that have been turned off or weakened neurologically or traumas. And so my daughter, Kenny, for example, she had a broken collarbone when she was 4 years old. And unbeknownst to me, certain patterns of the shoulder and low back were turned off. So there was 48 muscle tests in her shoulder. 20 of them were turned off completely, dead. And she plays college volleyball. We used a TRT to go over, and we literally turned on all those muscles in one treatment. And to this day, 2 months later, strong as can be, and she's rebuilding muscles. Crazy technology that I don't think we even tapped into all the possibilities yet.
No, we're just scratching the tip of the iceberg. And people ask me all the time, well, how many treatments do you need? How many is this? How many is that? the wild thing is that we've seen from research that it shows 3 to 6 visits to really get the maximum amount of stem cell production. And then remember, healing takes time. We see these dramatic emotional type videos from the first, second visits, but the thing I have to tell patients is really you've got to wait 8 to 10 weeks to see the true benefits, and sometimes 10 to 12 weeks. And this really just initiates that healing process.
100%.
Yeah.
Yeah, I can say that, what I tell patients too is anytime you sprain an ankle or have any kind of injury, it takes 8 to 12 weeks to heal. And even though we get immediate results when we, oftentimes very immediate results when we start to work with these people, it's kind of like I tell them, it's like painting a wall. You put one coat on there and it looks a little better. Then you put another coat. Pretty soon it's, you can see that it's a really nice painted wall. The body keeps putting out more and more stem cells every time we do one of these treatments. And it's an accumulative effect. And sometimes we have miraculous treatments on just one. Sometimes it takes a little while, but it depends on the injury. The cool thing is that this machine will actually diagnose and treat an area within 10 minutes. And that is phenomenal.
Yeah. Dr. Matt, you said something that was pretty accurate, I think, is most conditions, usually 3 to 6 visits, wouldn't you agree? We probably have the most, maximum stem cells, or that's really all patients sometimes needs. I have encountered that this machine works incredible for acute injuries. People don't understand, like acute ankle sprains or traumatic things, incredible healing with pain, inflammation, and the whole cascading healing effects. But even more so, the chronic injuries that have been there for years to decades, right, can go in and unlock healing potential. And some of these people, we see results in 3 to 6 visits, but some people, they take up around 10, 12, and then you really see magnificent changes when you give that body more time and more treatment to heal. So again, everyone's individual. That's what's so great about Dr. Duncan said. It's diagnostic at the same time. You can pick up the points that actually need treatment and not waste time in places that don't. So it's pretty phenomenal.
Yeah, and we don't really know how long healing takes. Everybody's healing at a different rate. That's a great point. And the thing that I've also said is, where else have we seen this? This may be the most versatile device that we've seen in the last 25 years. It might be have the least amount of side effects that we've seen. But also, where have you seen where you have a tool, a device that can not only diagnose and pinpoint the areas of inflammation, damaged tissue, but then start the healing process? Where else?
Yeah.
You know where else? You've seen it in science fiction movies and Star Trek, right, Doc?
Yeah.
Dr. Duncan is the one that called it the tricore medical scanner from where Dr. Bones. So yeah, I mean, this is what it's really tough for doctors, especially in our profession, that have not experienced this. It's out of their paradigm. They're just blown away. Like, wait, how does this really work? It slices. It's a floor wax. It's a dessert topping. We really have to focus on, how well it does just with pain. But we're going to see this in other specialties like urology, podiatrists, orthopedists, even plastic surgeons. We did recently get Class 2 clearance for wound healing and diabetic foot ulcers. Wow. And the FDA deemed us as a activation of connective tissue. Well, what is connective tissue? It's really the matrix of all, cartilage, ligaments, adipose tissue, even neuro tissue. So it's under that wherever we need healing, we can place this and create a positive biological effect.
I just want to tell the listeners out there, this is Dr. Duncan McCollum. This is, for the first time ever, McCollumWellness.com radio. We've got the whole month, and we're talking about a stem cell phenomenon, a machine called the Tissue Regenerative Technology Machine, introduced to myself and to Dr. Scott Kramer up in Reading by Matt Doduro. He's here right now. He spent a few hours in my office today, and it's amazing that this technology can actually, what you're talking about. And like I have these patients come in the office, they go, I don't want surgery. I'm 85 years old. They want to do back surgery on this lady. I was talking to her today. She goes, I won't survive back surgery at 85 years old. the doctor was mad at me that I didn't agree to it. And I go, well, thank God you didn't. You're here. Let's see what we can do. So, it's this machine has made such an impact on Scott and myself. And thank you so much, because we see miracles, like you said, that I haven't seen in 30 years and in the last year since I've had this machine. And everybody needs to try it. I think, Scott, you're doing the same thing as me for $49 for an introductory, so people can discover what the heck this thing is we're talking about, because nobody knows.
It's quite the buzz. It's quite the buzz. It's so exciting to go to the office. I mean, it's always exciting to go to the office, but when you have this new technology, you can't wait to get your hands on it and help people out with it, because you see so many positive affirmations and so many miracles in this thing. I even, as Dr. Matt knows, got another from my second office. And I have friends who can't wait, other doctors who want to find out what it's about. And so I take them to their office and start treating their patients, and everyone is just like, "Are you kidding me? Where's this machine been?" You're seeing people walking and talking and, getting over bone on bone knee pain, all these kind of miracles that they were, up told you can't help, but the machine, along with the natural healing of the body, can take care of all those issues and, become positive again. Pretty awesome. Thank you, Matt. I really appreciate all you've done for us.
Yeah, and
That's
it's
amazing.
It's awesome.
It's a sound wave, right? It's sound that is helping this innate intelligence that heals the body. So many people right now are concerned about their immune system because of everything going on, and California's on fire right now, on top of an
Literally
disaster. And people want to get their immune system strong, but and that means that your innate intelligence has to work better, your body's own ability to heal itself. And this machine works with, I don't know, you put it on the body and things happen that I've never seen happen in practice before. And it's just phenomenal. It's almost like I don't know what can't help yet.
I've said this a couple times, and I don't want to I know we have so many different specialties that use this, but I believe that this has the capability to be 10 times bigger than what decompression did for the chiropractic market. And why is that? Decompression could help with cervical and lumbar, but this device, you can use it on wrists, hands, elbows, knees, low back, neck. I mean, it's just, again, wherever we place it, it creates a positive biological effect.
Yep.
Hey, Scott, why don't you tell us a couple of your success stories, some patients that that just stick out in your mind that you didn't know that you could help and you were kind of blown away that you did.
Well, I think we can sit here all day and talk about that. One of my patients came in the other day, and she hasn't been there for a couple of years, and she's walking, and she's probably 70, 75 years old, rancher lady, and she takes care of all her animals, and she runs a ranch, and she's literally hunched over, and she can hardly walk. Her knees are so painful, I couldn't even touch them, like even brush her pants. Right? And I said, Judy, here's what we're going to do. I did her regular exam. We went and I showed her the TRT and did a trial. And I got to tell you, it was a little painful, but she totally tolerated it on her knees because they were so painful. And she gets up and she's like, "Are you kidding me? Are you kidding me?" She's walking around the office like she wasn't hunched at all on the knees. But then she came back. I said to my staff, my assistant Dale, and the next visit she came in, I was out there, and I was actually seeing Matt in Georgia. So Judy comes in, and so Dale went over her low back, and she has chronic, like post-surgery fusion, lots of bone spurs, just really horrible low back. And she's always been hunched like 30 degrees forward, can't straighten up. One treatment Dale did on her low back, and she is standing upright. She can breathe better. She's walking with full gait, no weakness at all. She's blown away. She's just absolutely blown away. And 2 years ago, there's no way I could have helped her with that because I didn't have this technology. Pretty crazy. But so we see, we expect to see those kind of miracles. So we expect that usually every time because that's what we see, right?
Yeah.
Yeah. I don't know. There's so many miracles. Why don't you share one, Duncan?
And
it's just
it's like when I got I think there were like 3 in Northern California. You got one immediately after me, and now like 3 of our friends have got it. So there's like 6 or 7 in Northern California, and it's like, how can we help more people? This thing is revolutionizing medicine, or whatever we're doing, because I'll tell you a really fun one. And Dr. Matt, you know about this, but a woman that came in with, she'd had plastic surgery. She had to have a skin graft on her leg for whatever reason. And she was in so much pain. She looked like she was, you know, so much older than she was when I first met her. And she presented with this incredible pain from this skin graft. And her mother had had one treatment on her knee, never came back. I don't have to come back because I'm out of pain. Brought her daughter in, did one treatment on this lady's skin graft, and it was the size of a football. She was out of pain for the first time since she can remember. She walked in a week later for another treatment, and I'm adjusting a patient, and I look up and go, who's that? Who's that walking like down my aisle like she knows the office? And she was unrecognizable. She was like, you know, happy. She had life in her face. And it was just like, this is so amazing that 10 minutes could do this where nothing else that I know of could.
You know, another great thing that stands out is I saw a gentleman last month for the first time, and he has a chronic frozen shoulder. So frozen, he can hardly do this. And he owns a heating and air conditioning business. And so really bad knees, his shoulder can't move. He's had his frozen shoulder in pain for a year and a half. He's tried injections, tried shots. He's scheduled for surgery August 7th, but this was a month before. So he came in for a trial offer. And this is how powerful it is. Just a little trial offer. I did TRT in his shoulder, and literally he's doing this. He probably said, "Are you kidding me?" Probably 50 times in 2 minutes. Are you kidding me? He had tears in his eyes. I said, "Okay, let me check your knee now." So we did his knee, right? He was still, "Man, I'm sorry, I'm fidgeting. I can't believe I can move my shoulder while I'm doing his knee." He stands up, he's walking around. "Oh my God, my knee feels incredible." So I think we've done 4 treatments on him, along with a couple of chiropractic adjustments. He's probably 90% better. All of his strength returned, full motion returned, just a little bit of discomfort. But his insurance company, he canceled surgery. His insurance company said, if you cancel surgery, you can never have it again because we're going to let you go as a client or whatever. So he was debating whether he should try the TRT or have the surgery. He's so glad he canceled surgery and he switched insurance company. So incredible stories.
That's beautiful. And let me tell you that what we're seeing is that you give us 10 minutes, we'll give your life back. That's a catchphrase that we're using. And that's all it takes. It takes a couple minutes to really locate and map out the area and really find out if they're a good candidate. And you have to feel it to heal it. And Dr. Duncan coined that last year. And it's just fun to see this. It's a transformational type of device.
Hey, we're up against the break. We're just going to take a quick break. This is Dr. Duncan McCollum with McCollumWellness.com radio. And so we'll be right back.
All right, guys.
Thanks, Scott.
Great job.
Bust out. So much. Love you both. You're awesome.
Thanks.
Thank you. Thanks for coming on.
I'll
send this up to you. I'll send it URL as soon as we get it up.
Okay. Bye.
Bye. Okay, we are back. This is Dr. Duncan McCollum, and I want to thank Scott Kramer for being on here. He's back to the clinic doing stuff that we're talking about, going out and saving people from a lifetime of misery with a machine that is revolutionary. And I got to just say, there's never any 100% guarantee in life on anything. But in 30 years of practice as a chiropractor in Santa Cruz, I've been working to help people's body heal themselves through this innate intelligence for years. And once I'll tell you my story. I injured my shoulder my whole life. I've injured my shoulder. It got to the point where I couldn't even lift it. And I'm adjusting several people, a day. And finally, I talked to a friend of mine. I found out that there was this machine called a tissue regenerative therapy machine. And I saw a friend of ours, Dr. Dan Pompa's son, jumped off a cliff trying to hit the water, and he hit a rock and broke 3 vertebrae in his back. He should have been crippled. But because I know Dr. Pompa really well, and I was watching the recovery of his son, all of a sudden there was this thing called a tissue regenerative therapy machine being done on his son, and he was on his feet in 4 weeks. when they wanted to put a cage around his back. And then the next thing I know, he's in Europe on week 6. And so I called Dr. Dan Pompa. I said, where do I find one of these machines? And he introduced me to Dr. Matt Diderot, who's on the show with me today. And Dr. Matt found me. I had to drive for hours to find a machine. I found a machine. I got one treatment. I could lift my arm almost over my head where I could barely lift it off my lap. 40% better. One treatment a week later was 80% better. I said, the heck with that. I'm not driving anymore. I'm buying one because I need it and the community needs it. So Dr. Matt, thank you so much for getting me one of these things. And I really appreciate you being here in town and talking on the radio with us today.
Yeah, I mean, it's funny that story with Daniel Pompa it transcends across the country, and what, how his healing was accelerated. In 80% of the cases, they're going to be paralyzed. So, with the two fractures he had at T9 and T10 in his spine. And back then, we really weren't sure. We had some hypothesis that what were happening. This recent spinal cord injury paper that just came out, it's a groundbreaking paper from last week. And it basically said that we actually activated the toll-like receptor 3 pathway, which has really been the holy grail in pharmacology. Like, they've been searching for this because if you're able to activate that helps downregulate inflammation. And inflammation is really the true killer.
Yeah. We know that chronic inflammation is causing chronic disease. And any way we can get rid of the inflammation, we're doing a huge thing. So, yeah, I think that we do a lot of extremities. We just about any part of the body we work on, we get positive results. And I would just want to let the people know out there that are listening to McCollumWellness.com radio for the first time now, that we are offering a $49 special. And I know Dr. Kramer is up there in Reading. And, just come in and check it out. The worst thing that can happen is you'll be the same. But I'll tell you one thing, we've seen some immediate miracles. I'm going to tell you another one. This gentleman was in one of my detox classes. We do a lot of detox, a lot of ketogenic diet, intermittent fasting to get the swelling out of the body or the inflammation. This gentleman, he's probably listening to the show. He was a Korean War veteran. He's about 73 years old, and he would get up out of the chair, barely get out of the chair during the class and walk over to the wall and stand against the wall for a little bit. And this went on for weeks, and I felt so bad for him. And finally I said, look, why don't you come in and let me try one of these treatments on you? He had a hard time getting on the table. I did one treatment on his low back, and he had back surgery. He had a scar about 4 inches long on his low back, and it was still red. It'd been like 3 or 4 years. It still looked red like it had happened 4 months ago. I did one treatment on him. He got off the bed and he started dropping the F-bomb. I mean, he's a Vietnam vet, and he was going, what did you do? What happened? What did you do? And he was completely out of pain. It was blown away. But now the other thing, those nerves that come out of the low back go down the legs, and his knees had not had correct nerve supply for so long, he couldn't bend his knees. He would walk by shuffling. And this is another treatment. He came back and he goes, can you help my knees? And I said, well, I don't know. Let's take a look. So we did a treatment on him. He stood up, F-bombs again. Next thing you know, this is the best story. They would walk on West Cliff Drive here in Santa Cruz every morning. And his wife would, they'd start together. His wife would walk all the way to the end of West Cliff and come back, and he'd be about 10 feet from where he started, sitting on a bench. Well, this day, she walked all the way, turned around, and the patient was about maybe 100 yards behind him, and she got freaked out. She goes, what's wrong? Did you have to bring the car here? Why are you here? And he goes, no, I walked. So it's giving me goosebumps because it changed his life so dramatically. And that is what's possible with this machine.
Yeah, it's now reproducible, right? We see this in 42 clinics that we put this across the country, and every week we see a different, what would be considered a medical miracle every week. And it's becoming commonplace in these TRT centers of excellence. And, again, great job. I mean, your staff is so proficient. You're able to see so many people. And let's face it, in our culture right now, people are sick and tired of having to take medication, possible narcotics that get you addicted. I mean, we have over 1,000 people per week still overdosing from prescription medicines and pain pills. And so, not to take anything away from the pandemic that's going on, but this is still an epidemic that's affecting us. And this is a true, I call it the opioid buster, because this gives people an option to help accelerate their natural healing, really unlock their full potential, and not have to do cortisone injections, stem cell shots, surgery, having knee or hip replacement. And let's face it, in the algorithm of healthcare, you don't start with the most expensive. Our goal is really to educate people out there. Like, stem cells are the big hype right now. And let's be clear about this. The show The Doctors that Scott's patient Shannon was on, they're the ones who nicknamed it the stem cell machine. They, when I presented it to them, they're like, why don't you just call it the stem cell machine? I'm like, you know what? You're right. But if these stem cells right now are $5,000 to $7,000 per joint. So if you do your wrist and your knee, or you're up at $10,000 to $12,000. So this is a fraction of the cost for patients. It gives them multiple visits between 6 and 10 sessions over 8 weeks, and it's a fraction of the cost. This is regenerative medicine options for the working class man and woman in our communities, and it shouldn't have to cost them an arm and a leg.
Yeah, and not only that, it's not invasive. Anytime you put anything inside the body, you run a risk. You end up, you can get bacteria, you can get any kind of thing in the joint. Your body can have an adverse reaction to something that's in the mix with the stem cells. You never know. And you just told me today that the FDA has rated this a minimum risk. How did they say that?
Yeah, it's called an NSR. It's a non-significant risk factor. And, that means minimal side effects. And here's the beautiful thing, Doc, and I want your listeners and your community to know about this, that this is a 65 to 91% success rate in clinical studies with musculoskeletal disorders. Again, that's most low back, knee pain, elbow, golfer's elbow, tennis elbow, plantar fasciitis. I mean, forget it. We're knocking it out of the park. And I want to tell you that, this groundbreaking paper on spinal cord injuries, this was done in 13 trauma centers in Austria and 1 in Germany. And over the last 2 years, they've made it a national health mandate in Austria that if there's a spinal cord injury, they have this treatment done within 72 hours. Whoa. Why? Because the research is saying that there is a neuroprotective component, and that the toll-like receptors 3 actually downregulate or prohibit inflammation. And so, they said that this could be a viable option, a potent option for spinal cord injury patients. And think of this, our whole healthcare careers, we've been told that the spinal cord can never regenerate. This is the first tip of a paper. First, we're just starting to scratch the tip of the iceberg on the potential for this, that it can actually, the toll-like receptors 3 has been identified as a crucial enhancer of spinal cord regeneration. Now think about that. That now it's in a zebrafish, but they start in animal studies, and they eventually will prove it in human studies. So again, this option is available for your community, and you guys have done a wonderful job to create this introductory special where patients can come in and find out if they're a good candidate for this. And again, Doc, you are a true tissue regeneration technology center of excellence, and your staff is really the cream of the crop. You guys have done a wonderful job.
Yeah, thank you so much. I have, my staff is awesome. I'm so happy to have them. They're so caring. They really look out for the community, and they know what they're doing. And our goal is to try to help people. If we don't think we can, we'll let them know. But this machine is so amazing that sometimes it's like, hey, you did $49, you might as well try it. Worst thing that can happen is you're the same, you know? So it's pretty phenomenal.
I like those odds, the 65 to 91%
Yeah.
success rate. I have to tell you, I know we only have a few minutes left. Let's tell you where we're at. There are 516 of these in the whole world.
Whoa.
You happen to be number 403. Okay.
Huh.
Your clinic. And that's one of the things I was doing today when I was out here. And so, that's amazing. There's only 145 or 150 in the whole country. They're at the Mayo Clinic, Cleveland Clinic, Shepherd Spine Center, which is one of the top 10 rehab hospitals in the country for especially spinal cord injury patients. It's at University of California, San Francisco. Dr. Thomas Liu is doing some amazing work. He's world-renowned urologist. He actually has an organ regeneration lab. I mean, think about that, where they're creating, replicating organ tissue in vitro, right? So, and also in vivo inside our bodies. Amazing. And one of the things I want to say is, like, now we have it in 4 NBA teams. You have it in New York Knicks, New York Nets, Memphis Grizzlies, and the LA Lakers, which recently just featured in the bubble, because they're all living in Orlando and playing there. Their center, 7-foot Javal McGee, actually showed a treatment online on YouTube, and he's had over 450,000 views in the first treatment. This is catching on. This is the more patients in our community learn about this, this is going to be consumer driven. They're sick and tired of not having this type of options, right? And we're so excited to be offering this in centers across the country. And again, it started off with me feeling like riding a bike by myself. And the more and more people that come around, we're building a true Peloton, and we'll be able to become more efficient and get this word. My mission is really to change healthcare and give people in chronic pain viable options where they don't have to drain their bank accounts. And it's just been so amazing. That I have a large diabetic neuropathy clinic in Atlanta, and my average age of my patients is 70 years old. And I have to tell you, through this COVID crisis, those type 2 diabetics and the 70-year-old patients, they're not leaving. My clinic kind of vanished. This device allowed me to survive 7-week shutdown and then rebirth my practice almost as a new clinic that is focusing mostly on alternative pain options. So patients who've had failed back surgeries, joint replacements that were not really successful, carpal tunnel, knee pain, wrist pain, elbow pain, even ankle pain, foot pain. So it is really opened up the world and allowed me to work with a variety of different conditions and still keep chiropractic as the core.
Yeah, and I've even worked with people with TMJ, the amazing thing, sinusitis. It's unbelievable what we can find. The machine will diagnose. If there's not a problem, you just move on. And the statistics that you mentioned, 65 to 90 something percent, typically when somebody comes in saying that their doctor said they need back surgery, oftentimes they say, well, the doctor told me that he has an 80 or 90% success rate. Well, you got to ask what success rate means, because you can go in for a heart transplant and they can successfully put in a new heart, but you can die 2 weeks later of complications, but they say the surgery was successful. And this is straightforward. If you go there to anywhere, ask, well, what does success rate mean? Because if you don't ask the right questions, you're going to think, oh, I have an 80% chance of being out of pain and playing tennis and chasing my kids on the beach. Where the statistics, from what I understand, is 30% of the time you're the same, 30% of the time you're worse, and 30% of the time you're better, with a 10% variable. So that means 60% of the time you're either going to be the same or worse, only 30% chance better. So, and once you're worse with surgery, you can't go back. However, I just told you about a patient of mine that was in pain for 2 years after surgery and got off the table and said, "What the heck did you just do?" He didn't say heck, but it was pretty amazing.
You know, what's funny, Duncan, is that what I've noticed, and I want to tell a couple of my real success stories out in Park City in July. One of Daniel Pompa's friends, who is really an Olympic downhill skier hopeful, and in mid-January he was skiing in a race and caught the gate and really dismantled his knee, his right knee, and ended up having to have surgery on February 13th of this year, just before COVID kicked in. And for 5 months he was treating in Fort Collins, and really the top Olympic facility for injured athletes. 5 months, and we treated him one day in Park City, and the guy, it's on my go to Free My Pain Now YouTube channel, and he's there, and you'll see it, and he says, "Why isn't this everywhere?" He's like, 5 months of rehab and you do one treatment and now I'm able to bend and do a squat. Another one, we went to Erica Mason, who's part of Dr. Pomp's wonderful group, and she's in Richmond, Virginia. And she had two wonderful cases that I want to talk to you about when we were there for a training day. One of them was a nurse. She's been a nurse for over 34 years, terrible knee pain for the last 4 years. And she gets a treatment, and again, she gets off the table, and you put the applicator down and you pick up your phone because you don't know what's going to happen. And she literally said, "Why isn't this everywhere?" I mean, people are like, why don't we have this? And it's a slow process, right? Unfortunately, medicine is an industry in this country, and something that is so groundbreaking and transformational. Really, it's like something goes off in people's brain that they just can't believe it's really happening. I referred to the Semmelweis effect, who Dr. Ignacio Semmelweis back in the mid 1800s was a medical doctor, and he literally was thrown off the stage at an international healthcare symposium in Vienna, where he said, look, he found that if doctors were going right from the morgue or dissection lab and they were called to go deliver a baby, well, doctors weren't washing their hands.
Wow.
It seems so crazy because we've done it now for 107 years, but he was the first doctor to actually document, the differences, and the mothers who gave birth were dying at a higher rate of like 15 to 18%, which was crazy. So he made this claim. He had a hypothesis. He said, listen, what if doctors washed their hands before they left the dissection lab and went to deliver a baby? So during the symposium, doctors said, how dare you? We are doctors. We are the highest level of educated in this society. How dare you say that? And they really ridiculed him and kicked him off stage. Unfortunately, Dr. Semmelweis actually died in an insane asylum alone.
Wow.
Because he was ostracized.
Yeah.
Now look at what happens 10, 15 years later is they start to realize this, before the germ theory was ever there, that they said, hey, maybe, we have to wash our hands and have cleanness. But first they ridiculed him, the AMA, the medical profession. Then they said, yes, this is our idea. And then they claim it as their own.
Yeah.
And that's seriously what we see with this. This is just like, hey, man, it's out of they've never seen it in their paradigm. So, again, thank you so much for giving us the opportunity. You reach so many great people in the Santa Cruz area, in the Monterey Peninsula area, and thank you for what you're doing and sharing this message with really Northern California.
You bet. We're going to take another break here. We'll be back in a couple minutes. This is Dr. Duncan McCollum on McCollumWellness.com radio. We just got a new name. I'm here every Saturday now. I have Dr. Matt Diduro with me. We had Dr. Scott Kramer on. This is our 1 year anniversary from the first show we did. And we've had so many amazing changes with the TRT machine, or the tissue regenerative technology, stem cell machine, whatever you want to call it. So we'll be back in just a few minutes. And we'll end this up with who knows what, but it's going to be good. All right, so we've got about another 15 minutes. Huh?
We have that long?
Yeah.
Oh,
We've
because we
only been at
started at
37 minutes,
perfect.
an hour show.
Okay,
Okay,
so
we're back. This is Dr. Duncan McElligott, and again, this is just an amazing show with an amazing technology and an amazing doctor here all the way from Atlanta, out here in Santa Cruz with me right now. And Dr. Matt Doduro, you have changed my practice and the lives of my patients by introducing me to this machine called the Tissue Regenerative Technology Machine. The television show, The Doctors, has coined it the stem cell machine. And, I just want to let everybody know that if you have any inkling of any kind of issue that's not getting better, then you deserve to come in for the $49 special. Find out if it works. If it doesn't, great. I mean, there's no 100% on anything, but the amount of miracles that we've seen in 1 year is just phenomenal. So Matt, tell us about this machine. A lot of people just tune in as we go on along the show.
Mm-hmm. Well, as we talked on one of your first shows, this is really genuine lithotripsy, which is the same technology they use in hospitals to break up kidney stones. It uses heat, light, and hydraulically produced sound waves. Now, if you just look at sound waves, like when Chuck Yeager broke the sound barrier, he was traveling just a little over 700 miles an hour. When you create a spark or sound wave within water, and that's the way we have in the applicator, now those sound waves are coming out of the body at 3,355 miles an hour. Now, that's pretty amazing.
Wow.
Well, why is that an issue? Because when it hits your tissue, it goes right through your tissue. And it really doesn't create any ill effect. It actually tricks the body into thinking that there's a new injury and creates a whole cascade of natural healing. So if you look at an injury, right, our body is set up very well to take care of a short-term acute injury, right? So after 4 to 6 weeks, it kind of shuts down that and says, I've got to go focus my energy and time on other things. Well, this actually tricks the body and without damaging tissue, and really it's a stem cell attractant. It activates your own body's natural stem cells within 6 to 8 weeks of treatment. It actually activates it in 45 minutes after the treatment, and then full and maximum migration happens 8 to 10 weeks. You have neovascularization within 10 to 12 weeks. What does that mean? That means as there's new blood pathways. And something that I explain to my patients is wherever you have pain, you have poor circulation and inflammation, okay? This device helps downregulate inflammation. We see this paper, right, that shows that toll-like receptor 3 has helped downregulate and decrease that inflammatory response. And it's just been really fun to travel around the country, teach other doctors, and bring this technology to different communities. Last year I was on a mission to put this in every state in this wonderful country of ours. And we're getting there. We're in like 30 different states, and we have 20 more to go. And thank you for being part of this mission and making it really enjoyable along the way.
Yeah, thank you. So it's kind of as you were talking about it, I realized it's like there's this term biohack out there where you're hacking your body's ability to do anything. So this is a biohack machine. It goes in there, and here's what I explain to patients. Like, I had a shoulder injury, which is why I got this machine in the first place, because it fixed, I couldn't even lift my arm. But what I see happening, and you just described it pretty well, when you have an injury, your body puts about 4 to 6 weeks of attention on healing that thing. Then it goes on to the next emergency, especially right now. There's so much stress in our lives. Even before COVID, there was so much stress in our lives that the body often goes, well, that's patched up well enough, and it goes onto the next area. And then we end up with an ankle that keeps getting sprained over and over and over again because it never got healed correctly. Or a shoulder, every time you throw a baseball with your kid, it hurts again because it never healed correctly. So what this machine does when you put it on the area, it finds that damaged tissue that never healed correctly, and it puts this shock wave into it, which stimulates the body to go, oh, yeah, I forgot about that area. Maybe I should go back and fix it now. So it drives your own stem cells that are lying in your long bone or in your bone to that area, So the stem cells, I mean, when you have an egg and a sperm, that's a stem cell when they come together. Pretty soon they divide into 200 different type of cells. So when we get stem cells into an area, it can become whatever it needs to become. It's a chameleon. It can be a muscle cell, a ligament cell, a kidney cell, a liver cell, what have you. And so when we put this on an old injured area, not only do we drive stem cells there, but as you mentioned a second ago, it also causes something called angiogenesis, which means new blood vessel formation. So we're actually getting a whole new blood supply to the area. And if you look at a piece of beef jerky, maybe that's a description of an old injury that's dried up, that doesn't have enough blood in it, and it's attached to a bone, and every time you stretch it too much, it hurts. When we do this stem cell treatment to that area, and from what I see happening, it's driving new stem cells to rebuild that area, but it's also building new blood vessel growth to put in nutrients and take out the old damaged waste out of the area. And I've never seen anything like it, and it's phenomenal.
You touch on a great point. So that those sound waves come out at 3,355 miles an hour. They can penetrate 8 to 10 inches into your body. And really what happens, it's calling for other helper cells to come to that area. Mm-hmm. So you have messenger RNA, but really what happens with the cell membrane, it's working on a cellular basis. And that high pressure, low pressure that we create, it's like taking a thunderbolt and lightning and putting it into an applicator that we can point at the body. And what it does was the sound waves come out at 3,355 miles an hour is it creates a shearing force on the cell membrane. And it compresses the cell, and this is all happening in 3 to 4 microseconds. It compresses the cell and then expands it by 10. And that shearing force, it's got this positive force and a negative force. It creates this, it breaks away that fibrosis, and it breaks away those oxidative stresses that are built up in these injured cells. And now all of a sudden, the cell is able to get nutrients in through diffusion and osmosis and waste products out, as well as messenger RNA and exosomes, which again are the precursors to stem cells. And it activates your body's own natural healing ability. And we've seen it in scars. That's why we have Class 2 clearance with wounds and diabetic ulcers. We now have it in the VA Center in El Paso, Beaumont Medical, also the Walter Reed Hospital. This is amazing that our veterans and our military service people are going to have access to the top type of care in the world, really. And again, it's medicine and industry in this country. Most of the research has been done outside of the United States in socialized healthcare systems, right? Because it's not about what's the most expensive or most invasive. It's what's the most efficient, and it's going to be the most effective. And we found that when you use our device, you need less treatments, people get better quicker, and they're happy. So, it's a really the foundation for success in any clinic, and again, helping in the community.
Yeah. And, so I think it's really interesting. I mean, you have gotten, I don't know how many you've put around the country. I know several of my friends and our friends now have gotten these machines because our association with Dr. Dan Pompa, who's like the Cellular Healing guy, which is also could be a whole nother discussion and has been. But, it's like, how long does it take to get this thing into the hands of the average person there that is suffering and taking pain meds, and that's affecting their brain? And, we even know that pain meds are associated with Alzheimer's disease now. If you use chronic use of any of the aspirins and Advils and all that stuff, is now they're linking that to other kind of diseases, and Alzheimer being one of them, or dementia. So anytime you can put something or do something to your body that's natural, non-invasive, and has no drug to it, you're certainly giving your body a better chance to heal. And a lot of times those things that you take that are cutting out your symptom of pain trick your body into thinking that it's better, and you only damage it more. I remember as a kid one time, First time I had Novocaine, it was kind of cool. I was about 5 years old, and I started chewing on my cheek, going, "Wow, this is cool." I don't feel this. I remember this. I chewed on my cheek and I crunched it. And when that Novocaine wore off, man, I had the worst pain in my mouth that you could imagine. But nobody never told me not to chew on the inside of my cheek because I couldn't feel anything. So when you take painkillers of any kind, and then you go out and work out, or you go and work in your garden, or just carry on the activities of daily living, even if you're a construction worker or you're working a physical job, and you're covering up your symptoms with any kind of drug, you're looking for worse and worse scenarios, hurting yourself more and more, blowing out discs. And, even all of that stuff we've seen success with, but you sure as heck don't want to wait until it's untreatable. Get in here as soon as you can. $49 special, McCollumWellness.com. Go to Dr. Duncan McCollum, or just go to McCollum Chiropractic Center in Capitola. That's where I'm at, $49.
Hey, you know what? The communities that in America right now, we're sick and unhealthy. And if anything, this COVID has really pointed out our weaknesses in our healthcare system and in our diets.
Yeah.
And I talked to you a little bit about Dr. Kate Shanahan. She's drcate.com.
Mm-hmm.
She's an amazing medical doctor for over 25 years. She's also the nutritionist for the LA Lakers. And she has some really wonderful theories. And she talks about, these people that are dying from COVID.
Yeah.
It's not from the actual novel virus. It's actually from the immune response, the cytokine storm that hits the body, which is basically inflammation that runs systemic throughout your body and shuts down your kidneys and everything like that. She's seen a high correlation of people who are taking statin drugs or blood pressure medicine that are ACE2 receptors, and that's where that COVID attacks. But the one thing she said, she was on Dr. Drew Penske's podcast last month, and he said, well, do you think that we should take these patients off statin drugs? That's cholesterol-lowering medication. And by the time they get in the hospital, and she goes, well, by that time, it's too late.
Wow.
So statin and cholesterol drugs are an anti-angiogenesis. They stop the formation of these new blood pathways. So, and it's probably, and I'll say this on your show, and I'll put 26 years of being a healthcare provider behind this. I think statins are the biggest con on our healthcare and our and the Americans. They've been sold a false bill of good that you have to be on these for month, day after day, month after month, year after year. And, we're finding out cholesterol is a good thing. Dr. Kate also mentioned that people with higher cholesterol levels in Wuhan, China, actually survived this COVID onset better than people who had lower cholesterol. So again, this is a good time for us to look at our diets, our healthy, our exercise. I mean, this device is just a piece of the puzzle to help improve your body and help extend your life, and it's a longevity type of device. And a quick shout out, I don't know if we have much time left, our good friend Karen Laurie, who's one of the original biohackers, and she is the Chuck Yeager of this stem cell machine, because she's probably had more stem cells administered over any period of time to her body. And so nice shout out to Karen. We look forward to having her on one of your next shows. She's just an amazing woman.
Absolutely. And she has actually, because she's been a flying trapezist, a gymnast, she has really kind of shown you and me some things that we didn't know would happen when you use this machine on your body and you create this incredible new health. So it's amazing what this thing can do. And, we've got about 3 or 4 minutes left. I just want to, again, appreciate you and John Warlick for, getting this thing going and getting it out to the people of the United States. And I know that you've been working with Dr. Dan Pompa quite a bit, and that all of the health centers of the future pretty much have these. So if you are if you're listening to this online, because it's ksco.com, and you want to find a doctor that has this, you can definitely contact us. And Matt, why don't you give us your information, where we can find you and that?
Yes. So I have YouTube channels, drmattdeduro.com, and also drdeduro@gmail.com. To find another practitioner around the country, because I know that this is going national, you can go to softwaveproviders.com. That's softwaveproviders.com. Find a center of excellence near you, and really you owe it to yourself to experience this and see if you're a good candidate for this, obviously very transformational type of device.
Yeah, thank you so much. So again, this is McCollumWellness.com radio for the first time. And I appreciate everybody's tuning in. Call my office, McCollum Family Chiropractic in Capitola. Get your $49 special. Tell your friends, anybody you know that needs this technology, or you're tired of them being in pain, get them into my office and let's see what we can do. All right, we're checking out. We'll see you all next week. One more thing.
One more thing. We have one rule at all these clinics. If this technology helps you, all we ask is you tell others. And that's the way we're going to share this. We're not going to keep this a secret anymore. Thank you, Doc, for everything you've done.
Thanks, man. Good night. Goodbye, everybody.